What if one of the most dangerous things for your cat is sitting in your house right now? Not a wild animal, not a disease, something you probably use every single day, and millions of cat owners have absolutely no idea. Today, Dr. Elie reveals the hidden household dangers that could seriously harm, or even kill, your cat.
Cats love a sunny windowsill, but many common houseplants placed there can be dangerous if your cat sniffs, licks, or nibbles the leaves. Lilies are the big one. Every part is unsafe for cats. Even a tiny dusting of pollen on fur can be licked off later and make them very sick. If there's any chance of lily exposure, treat it as urgent. At the clinic, we act fast because quick care can make all the difference. At home, move trailing vines and tempting leaves out of reach and swap risky plants for cat-safe options, like a pod of wheatgrass your cat can chew. If a plant is chewed, watch for drooling, vomiting, refusing food, or signs of belly discomfort. Call your veterinarian right away if you notice any of these. The best approach is prevention, pet-proof like you would child-proof. Know your plants, keep toxic ones out of the home, and place safe greenery well out of reach. In serious cases, cats may need IV fluids and close monitoring, but with prompt, gentle care, most do well. Remove lilies and peace lilies from your home entirely, and replace decor with faux plants or verified cat-safe greens. With hazards gone and safe plants set up high, your cat can nap by the window, comfortably and safely. Essential oils are more dangerous to cats than most people realize. Diffusers aerosolize droplets that settle on fur, and cats ingest them through grooming. Even a small spill on a countertop can transfer to their paws and coat. Cats lack the liver enzymes to process many oil components, so even small exposures can build up and cause toxicity. My rule is simple. Don't diffuse around cats. Never apply oils to their skin, and store bottles safely out of reach. Watch for drooling, wobbliness, lethargy, or breathing changes. If you suspect exposure, move your cat to fresh air. Gently wipe any residue from their coat with a damp cloth, and call your veterinarian or a pet poison hotline immediately. In the clinic, we provide oxygen, IV fluids, and liver protectants. Most cats do well with prompt treatment. Early action makes all the difference. Human medications are a leading cause of feline poisonings. Even a single tablet can be dangerous, so never leave pills on a counter or table. Store all medications, prescriptions, over-the-counter drugs, and supplements in a high, latched cabinet. Use pill organizers only inside closed drawers, and keep purses and backpacks zipped and hung up high. If you suspect your cat swallowed any medication, call your veterinarian or an emergency hospital immediately. Bring the bottle with you. Noting the drug name, strength, and time of ingestion speeds up triage. At the clinic, treatment may include decontamination, IV fluids, and close monitoring. Prompt care saves lives. Build safe routines. Take your own meds over a sink. Wipe counters to remove residue, and use a sealed trash can for discarded pills. Small steps offer big protection.
String-like items, hair ties, thread, ribbon, floss, even long carpet fibers, tempt cats to chase and chew. The danger starts when a piece is swallowed and one end gets anchored, often under the tongue or near the stomach. What looks like harmless play can become a medical emergency in minutes. This is called a linear foreign body. As the intestines try to propel the string, it cinches and accordions the gut, sawing into delicate tissue. That can cause obstruction, loss of blood supply, and even perforation with life-threatening infection. Treatment is time-sensitive. Many cats require anesthesia and surgery to carefully remove the string and repair damaged segments. Earlier care usually means fewer incisions and better outcomes. Your veterinary team is trained to act quickly and safely. Prevention starts at home. Store hair ties, sewing thread, ribbon, and floss in lidded containers. Keep craft and sewing kits in closed drawers. Trim or secure dangling cords. And clean up string toys immediately after play. Choose safer play. Supervised wand toys that you put away after each session. Sturdy kicker toys, tunnels, springs, and food puzzles. Rotate toys to keep interest high and never leave string toys out unattended. Watch for red flags. pawing at the mouth, gagging, drooling, vomiting, abdominal pain, loss of appetite, lethargy, or a string under the tongue or protruding from the rectum. Do not pull the string. Keep your cat calm, confine them, and call your veterinarian or local ER immediately. Do not induce vomiting unless instructed. Quick action saves lives, and with prompt care most cats recover well. Secure the strings, choose safe play, and you'll keep curiosity fun and out of the operating room.
Let's start in the kitchen. Chocolate, especially dark or baking chocolate, contains theobromine and caffeine that cats can't process. Keep sweets sealed and well out of reach. Onions and garlic, fresh, powdered, cooked, or in sauces, can damage red blood cells and cause anemia. Wipe prep areas and guide curious paws off counters right away. Grapes and raisins can lead to sudden kidney failure. Don't assume just one is safe. Store them immediately in the fridge or a latched pantry every single time. Alcohol, from wine glasses to cocktail spills, is dangerous even in small amounts. During gatherings, move drinks high, clean spills fast, and give your cat a quiet, safe room. Energy drinks and strong coffee contain concentrated caffeine and other stimulants. Close cans, put them away, and keep only water at your desk within paw's reach. If your cat may have eaten any of these, act now. Remove access, call your veterinarian or poison control, and bring the label. Quick action saves lives. Prevent mistakes by teaching family, especially kids, not to share table scraps. Feed your cat at a separate, calm station so people food never becomes a temptation. Build safe habits. Offer a balanced diet in ceramic or stainless bowls. Refresh water with a fountain, and store all risky foods high, sealed, and out of sight.
Cleaning products can harm cats even in tiny amounts. Ingredients like bleach, quats, phenols, ammonia, and strong fragrances can irritate skin, eyes, and airways. And residue left on surfaces can be licked off later. Wet floors are risky. Cats absorb chemicals through paw pads, then groom and ingest them. Keep pets out of freshly cleaned areas with a gate or closed door until the floor is completely dry and no odor remains. When disinfecting counters, follow label contact time, wipe thoroughly, then rinse with clean water. Always ventilate, open a window or run a fan, and never mix products, especially bleach with ammonia or acids. Remember, cats self-groom constantly. If paws or fur contact a cleaner, rinse promptly with lukewarm water and gently wipe away residue. Switch to pet-safe products and thoroughly rinse mops and cloths after use. After a significant exposure, a gentle bath with a veterinarian-approved shampoo may be needed. Do not induce vomiting. Call your vet if you notice drooling, vomiting, coughing, wheezing, red eyes, or lethargy. Store all cleaners high and locked, caps tightly closed, in original containers. Secure under-sink cabinets with child locks, and keep soaked sponges, rags, and mop heads out of your cat's reach. Choose pet-safe, low-residue options without phenols or strong scents. Dilute exactly as directed, and start with a water-only pass before treatment. Color-code your bottles and make ventilate, rinse, and dry your cleaning checklist.
High-rise syndrome is real. Cats fall from open windows because they chase movement, misjudge distances, or slip off narrow ledges. A breeze, a rustling curtain, one startle is all it takes. Window screens are not safety devices. Many are weak press-fit frames that can bow or pop out under a cat's weight. Balconies are risky too. Railings have gaps, slick surfaces, and tempting edges. Supervised balcony rules only. Harness and leash with you right there, or keep the door closed. If a cat heads for the rail, gently bring them inside and redirect to a safe perch. Make windows cat-safe. Install sturdy metal mesh or pet-rated screens secured to the frame. Add window guards and set adjustable stops so the opening is no more than 2 to 3 inches. Test fittings routinely and replace any warped or loose hardware. I'm glad she made it. Falls can cause broken jaws, chest trauma, internal injuries, even from a single story. Simple prevention, guards, stops, secure screens, and supervision can keep curious cats safe while you enjoy fresh air. For outdoor vibes without the risk, create a secure catio or enclosed window box. Use rigid mesh, solid latches, and shaded perches at different heights. Introduce it with treats and play so it feels like their favorite hangout. With sturdy screens and a locked mesh barrier, your cat can sunbathe safely and watch the world go by. A small upgrade today can prevent a life-threatening emergency tomorrow.
Electrical cords are irresistible to many cats, dangling, bouncing, and perfect for batting or chewing, but that curiosity can cause painful mouth burns or even dangerous electric shock. Under-desk tangles are especially tempting, so start by reducing access wherever your cat explores. Check cords often for bite marks, frayed or split insulation, kinks, exposed wire, warmth, intermittent charging, or a faint, scorched smell. If you find any damage, unplug the cord immediately and discard it. Don't cover it with tape. Prevent problems by lifting cables off the floor, routing them through cable raceways, adding split loom tubing or thick cord covers, and dropping power strips into closed cable boxes. Secure lines to furniture, use bitterant sprays as a deterrent, and unplug or block access when cords aren't in use. If you suspect a chew incident, turn off power before touching anything and look for drooling, pawing at the mouth, singed whiskers, lip burns, coughing, or breathing changes. Call your veterinarian. An oral exam is important to treat burns and prevent complications. Give safe alternatives: chew-friendly cat toys, silicone teething sticks, regular play with a wand toy, and puzzle feeders to occupy that energy. Reinforce good behavior and keep charging stations behind doors. Your cat learns to ignore cables when better options are always available. Candles and open flames are a hidden hazard for cats. A curious tail can flick through a flame in a split second, and fur ignites faster than you think, leading to painful burns or even house fires. If you use candles, keep them completely out of reach, never leave them unattended, and snuff them out the moment you step away. Then store them in a closed cabinet. Kitchens are another danger zone. Gas burners, electric coils, hot pans, and spattering oil. Set firm cooking time boundaries. Use a baby gate or keep counters off limits. Turn pot handles inward, use back burners, and add a stove guard or knob covers. Never leave an active burner unattended, not even for a minute. Safer, cat-friendly ambiance options include LED flameless candles and enclosed wax warmers placed in sturdy holders, far from curtains and whisker-high surfaces. Choose weighted bases, secure cords, and unplug devices when you're done to remove residual heat. Think broader fire safety too. Test smoke and carbon monoxide detectors monthly, keep a kitchen-rated fire extinguisher handy, and plan an evacuation with carriers by the door. Window decals can alert responders that pets are inside. Final flame-free checklist: candles out, burners off, matches and lighters locked away, warmers and incense unplugged or extinguished. Do a last switch sweep, then relax. Your cat can lounge safely while you enjoy peace of mind.
Stress in cats is a health issue, not misbehavior. Watch for pacing at windows, over-grooming or hair loss, increased vocalizing at doors, changes in appetite or litter box habits, and new hiding or irritability. Always rule out medical causes first: pain, dental disease, gastrointestinal upset, urinary tract problems, parasites, or thyroid disease. Schedule a veterinary exam. Keep a simple diary of triggers and bring video of behaviors if you can. Then enrich the home. Add vertical space with shelves and a window perch. Provide multiple sturdy scratching posts. Rotate toys weekly. And use puzzle feeders to turn calories into brain work. Do a daily 10-minute interactive play session. Wand toy to chase and pounce. Then offer a small meal. That hunt, catch, eat, sleep sequence lowers arousal and builds a predictable routine. Create a calm retreat, a quiet nook with a covered bed, soft blankets, gentle white noise, and resources nearby. Vet-approved pheromone products can help. Sprays or wipes on bedding are useful. If you try a diffuser, Place it out of reach and unplug it when you're away. For multi-cat tension, go slow. Start with scent swapping. Feed on opposite sides of a barrier. Add short controlled visual sessions and duplicate resources, litter boxes, bowls, beds, and perches in separate zones. With consistency, most cats relax and confidence returns. Celebrate small wins. Adjust one variable at a time, and if stress persists, partner with your veterinarian or a certified behavior professional. I recommend pet-proofing your home just as you would child-proof it, because prevention is always easier, safer, and far less costly than an emergency visit. Make routine care non-negotiable. Schedule wellness exams at least yearly, twice yearly for seniors. Keep vaccines and parasite prevention current. Trim nails regularly, brush teeth several times a week, and track weight and body condition. Note any changes in appetite, thirst, litter box habits, breathing, or energy, and call your vet early. At home, use a simple daily checklist: fresh water, measured balanced meals, clean litter, short interactive play, safe spaces, meds as prescribed, and rotating enrichment. Log observations on your phone. Small, consistent habits prevent big emergencies.
At every rescue intake, our team greets cats and carriers with calm voices and slow, gentle handling. We confirm identification, scan for microchips, review any history, and quietly triage to keep stress low. Then our techs provide supportive treatments, fluids, pain relief, and monitoring, so each cat can rest. Clean kennels, soft bedding, toys, and enrichment help them recover, while we educate families on safe, compassionate care. Dr. Elie Pet Rescue is a 100% nonprofit, no fluff, no overhead bloat. Your donations go straight to the animals. Feeding, urgent rescues, medical treatment, and daily care across the country. Whether you give today or next month, the work never stops. Teams clean enclosures, restock food, and monitor charts every day. Your support keeps lights on, shelves filled, and cats safe and calm. Supporters can also help through Dr. Elie Skincare and Cosmetics. All products are gluten-free, paraben-free, talc-free, FDA-approved, cruelty-free, and designed for both men and women. 100% of proceeds help support feeding, rescuing, and treating animals nationwide. Your cat trusts you to keep them safe. Sometimes the biggest dangers aren't outside your home, they're already inside it. A few simple changes today could save your cat's life tomorrow. Ready to help? Tap the link in our bio and press donate. In seconds, your gift goes straight to food, rescue, and medical care for cats in need. Every dollar matters. Thank you for protecting them.